4.5 years ago, my then 13-year-old daughter was diagnosed with type 1 diabetes. She uses detemir or Levemir, and I'll use those terms interchangeably, successfully. It allows flexibility around her menstrual cycle and athletic activity. Other options have been less flexible and have introduced risks we are not comfortable with, including unpredictable, frightening hypoglycemic episodes that can occur if glargine is injected into a blood vessel. The decision to discontinue this life-sustaining drug by its sole manufacturer of 20 years was not made because of safety concerns. It was a business decision. Detemir is the only roughly 12-hour flat basal insulin. It's an essential option for many, including pregnant women, many small children, and those who do not tolerate the few alternatives. Historically, if a patient experienced adverse side effects from a specific insulin, there were options to switch to. That ability is disappearing. Glargine is the basal insulin biosimilar manufacturers are focusing on as the traditional insulin manufacturers shift their attention to weight loss drugs. Insulin pumps are used by fewer than half of those with type 1 diabetes and are seldom used by those with gestational diabetes who require insulin. Even pump users require backup insulin in the case of pump failure or the need to remove an insulin pump. Here's a quote from a physician specializing in diabetes and pregnancy. Detemir is preferentially used in pregnancy by experts over other basal insulins. This preference is in part a function of detemir's pharmacokinetic characteristics, such as the relatively short half-life that allows for split dosing to help mitigate the morning glucose rise during pregnancy, and its faster metabolism, which helps avoid hypoglycemia in the setting of a sudden reduction in insulin resistance postpartum. Other long-acting insulins have remaining questions about applicability of use in this population. I was recently in Washington, D.C. with the Office of Representative Celeste Malloy, and I was alongside physicians specializing in diabetes and pregnancy. One of these physicians shared a recent example of a patient who came into her clinic. She had transferred from another clinic. This patient was pregnant, she had type 1 diabetes. She needed to be delivered immediately due to preeclampsia. This patient had just taken her dose of ultra-long-acting degludec just prior to delivery. After delivery, she developed severe prolonged hypoglycemia, required a glucose drip, and nearly required ICU admission. This physician explained that had the patient been using shorter-acting detemir, the situation would have been easier to manage. So how do we fix this? Novo Nordisk could help us in a variety of ways. They have declined our repeated requests for assistance. Without Novo's help, detemir production can begin by new manufacturers if the FDA designates detemir a drug in shortage. We requested assistance from the FDA over a year ago through a citizen petition, and we never received a meaningful response. I am grateful that all 4 Utah congressional representatives, including Representative Blake Moore, who will be speaking to us in a few moments, joined other members of Congress in requesting a path forward. The FDA's response to these congressional representatives was that the drug shortage staff determined that degludec and glargine remain available and in good supply. I ask you, how can a consistent, flexible 12-hour insulin be replaced by 2 much longer acting alternatives that do not meet many patients' needs and that many find unsafe? That's why I'm here. We've been told that more voices, specifically the voices of physicians and healthcare providers, are needed to encourage the FDA to address this. If you write a statement of support on a card that's on the middle of your table, we will collect them after this session. It would be incredibly helpful. Please include your name, your title, your email address, and your city. You don't need to address it to anyone. We'll take care of that. You don't need to be a provider who prescribes insulin to help us. Your voice as a physician or a healthcare provider carries tremendous weight. We will add these statements to an amendment we filed to our active FDA citizen petition, and will deliver them directly to decision makers including our elected representatives. I want to share this quote from a Levemir user. Levemir has given me the freedom to live a normal, active life without constantly fearing crashes. And my final quote comes from a Levemir user who experienced dangerous side effects and worsening blood glucose control with the few alternatives, and whose personal supply of Levemir is dwindling. God help us. Thank you very much.